North Carolina's budget and Medicaid funding are currently at an impasse, with the state budget not yet fully passed. It has led to significant funding shortfalls for Medicaid in our state, forcing cuts that are impacting healthcare providers and potentially patients. News 13's Itanise McMiller joins us now in the studio. Itanise.
Yeah, Tammy, healthcare providers are taking pay cuts and some services are no longer being provided. It's leaving people with disabilities vulnerable and left them bearing the brunt of political disagreements. The Medicaid rate reductions went into effect last month when attempts by lawmakers to approve increased insurance funding in the budget failed. It's resulted in the North Carolina Department of Health and Human Services cutting rates to providers anywhere from 3 to 10%. Melinda Plew with the ARC of North Carolina says these services are critical for people with intellectual and developmental disabilities, adding that their independence and safety is at risk.
I have a family member who lives in a facility, in a group home in my community. If that provider goes out of business or they decide to shut down that group home, and that is happening, we do know that that is happening in places across the state, then that means that person with a disability is essentially homeless.
Plew says this is where their tailored care management team steps in to try and get people rehoused. The ARC of NC is also in discussion with state lawmakers to make them aware of how critical Medicaid services are. They say conversations are productive, but they are still waiting on actual solutions. And in court this week, a Superior Court judge did block cuts to providers who service children with autism. The judge said doing so could cause irreparable harm to children. That means payment rates cannot be cut before a trial.